Hello and welcome to this Coaching Veterans presentation on ED, presented by me, Paul Bunn, with Veterans Outreach Ministries. You can reach us at 1-888-830-1942 or visit us online at www.vetcenters.org. Today we're discussing a topic many veterans experience but often avoid talking about: ED. It's a common and treatable condition, and the VA does provide benefits and special monthly compensation for those affected. ED is the inability to obtain or maintain the ability to perform. It can be physical, psychological, or a combination of both. For many veterans, ED results from service-related injuries, stress, or medications. It can also stem from nerve damage, circulation problems, or long-term health conditions. Example: I developed ED after a back injury in service, and the medication I take for pain made it worse. Common causes of ED among veterans include diabetes and nerve damage, PTSD and depression, spinal or pelvic injuries, blood pressure or pain medications, hormonal changes, and stress or aging. Many of these are connected to military service, whether through injury, exposure, or chronic stress. Example: my PTSD and anxiety medications caused side effects that made ED a problem. ED may be directly service-connected if it began while on active duty or was caused by a specific injury or illness. It can also be secondary to another service-connected condition such as diabetes, PTSD, or a spinal condition. In many cases, veterans develop ED after years of medications or complications from other disabilities. Example: my doctor linked my ED to my diabetes and nerve damage from service. Under 38 CFR Section 4.115b, the VA recognizes ED as a compensable disability, but generally does not assign a percentage rating unless there is physical deformity of the organ, which is rare. Instead, most veterans who experience loss of function qualify for special monthly compensation under SMC-K. Example: I was awarded SMC-K after my exam confirmed loss of function, even though I didn't receive a percentage rating. Special Monthly Compensation K, or SMC-K, is an additional benefit for veterans who have lost the use of a creative organ. It acknowledges not only the physical loss, but also the emotional and relational impact it can have. This benefit is available even if your ED itself is rated at 0%. Example: my urologist confirmed loss of function, and that was enough to qualify me for SMC-K. In real-world terms, SMC-K provides approximately $128.62 per month as of 2025, and it is added to your current VA benefits, not a replacement. You can receive it whether your main disability rating is 10% or 100%. It's simply an additional monthly amount acknowledging this specific loss. Example: my doctor confirmed permanent loss of function from diabetes, and I receive SMC-K along with my existing compensation. Here are some examples of honest veteran statements that help describe this condition during a C&P exam. I lost function after my diabetes worsened. My antidepressant medication makes it hard to maintain ability to perform. My spinal injury left me with numbness and limited sensation. My wife has noticed the change, and it's affected our relationship. These statements are straightforward, factual, and respectful. That's the tone you want to use at your exam. Diabetes is one of the most common underlying causes of ED in veterans. High blood sugar can damage nerves and blood vessels, leading to poor circulation and loss of sensation. This is often secondary to service-connected type 2 diabetes. Example: after years of high blood sugar, my doctor told me nerve damage was the cause of my ED. PTSD and depression can also lead to ED, both from the mental strain and from medications used to manage those conditions. Anxiety, sleep disruption, and antidepressant side effects are common contributing factors. Example: my PTSD triggers anxiety that makes intimacy difficult, and my medication makes it worse. Spinal or nerve injuries can disrupt the signals needed. Damage from lower back injuries, disc problems, or nerve compression can lead to chronic ED. Example: my lumbar spine injury caused nerve damage that affects my function and sensation. Many veterans experience ED as a side effect of medications. Painkillers, blood pressure medications, and antidepressants are common culprits. If this applies to you, your doctor can document the connection. Example, my hypertension medication caused ED, and my provider confirmed it was linked to my service-connected condition. When preparing for your compensation and pension exam, remember to be direct and honest. The examiner's job is to document, not to judge. Explain when the issue began, what treatments you've tried, and whether medications help. If your doctor prescribed ED medication, mention that too. Example, I told the examiner that my medication helps sometimes, but I still can't maintain function without assistance. Spouses or partners can provide strong supporting statements. Their observations show how ED impacts your relationship and emotional health. A spouse might note difficulties with intimacy or the emotional toll it takes on both partners. Example, my wife wrote that we've had to adjust our relationship because of my medical issues and that she helps track my treatments and appointments. ED is a sensitive topic, but it's also a valid medical condition that affects many veterans. The VA recognizes it under 38 CFR Section 4.115B, and most veterans qualify for special monthly compensation under 38 CFR Section 3.350A. SMC-K adds about $128.62 per month as of 2025 to your regular compensation. Don't ignore this benefit or feel embarrassed to discuss it. You've earned it. For more information, visit www.vetcenters.org or call 1-888-330-1942. You've served your country. Now it's our turn to serve you.